This is AMS-Gemma4 Antibiotic Stewardship Clinical Decision Support System built by Gemma4 E2B for Indian hospitals. This entire system runs in this MacBook without internet, without cloud. The patient data never leaves from this device. This is an offline native function calling both English and Tamil. Let me show you a real clinical case study. Mrs. Meenachi, 72 years old female, and her weight is 55 kg, and her creatinine output is 1.4 milligrams per deciliter. From this report, there is no known allergies for her, and that organism identified is E. coli. She is infected by E. coli urinary tract infection, and the reports may shows nitrofurantoin is sensitive. Obviously, this is the first choice for these UTI infections in many hospitals, and the ceftriaxone is also so sensitive, and ciprofloxacin is so resistant. Now I click get antibiotic recommendation button. Now see the first Python calling happens before the Gemma reasons. This Gemma software may use the creatinine clearance calculation through Crowdcraft method by using Python with reference to WHO AWA tires for ICMR resistance, for lookup resistance. Now let me run this device. It may take few seconds and I will show the results and tell you what is happening here. Now you see the CRCL 31.5 ml per minute, moderate impairment, that is moderate renal impairment. Nitrofurantoin is unsafe because as we know creatinine clearance is less than 60. It having an impairment in renal, it didn't releases from our kidney, that leads to some peripheral neuropathy for elder patients. But as per WHO, nitrofuran acid is preferred. But from our software we understand that creatinine clearance 31.5 ml per minute means it having a renal impairment, so this drug is unsafe. As well as in addition, the software may give that recommendation, that is clinical recommendation. Here that antibiotic stewardship whole protocol is going on. It may give the pathogenesis analysis as well as creatinine clearance calculation for it. You see that the real calculation is going on, and the safety check and recommended antibiotic it also gives. You see this line nitrofurantoin is rejected because here we use 60, and the path for ceftriaxone, and it also gives the dose how to take the ceftriaxone. This whole stewardship reasoning may happen in this software. Now the future, no other team in this competition have. Now you see the same clinical recommendations in Tamil for doctors in Tamil rural areas. Now I get this antibiotic recommendation. Now see what it happens. It may take few seconds and the results may show in entirely in Tamil. It is an offline free. Any hospital can deploy it, especially in rural areas of Tamil Nadu. Now wait for few seconds. Now you see the clinical results may come, the clinical recommendation may come in entirely in Tamil, and it shows to reject this nitrofurantoin and the pass that subtraction. Not only that, in addition, I will give these 3 Gemma4 features, that is multi-model upload culture report photo. Now we just see, I may just click upload. Now you see the report will show this page. I upload this chart. Now I will give the recommendation. In Tamil I will be English. It may comes. The function calling that Python and verified its max. It may an edge development offline on 8 GB RAM, no GPU, no cloud, no subscription needed. It is free for all. Now it shows the result with the image. Same image I will give for this machine Minashi. It may give 31.5 and I placed dummy, that's why it give the data like it. Now you see it may reject that night of error. I using Gemma to build this antibiotic stewardship. Thank you.